Jamala Kim as Alvis, student nurse from Camarines Sur Polytechnic College. So for today, I am going to demonstrate the cold application to the patient or providing the patient a cooling sponge bath. So without further ado, let's get started. Then next, we need to know the purpose of the procedure. So the purpose of providing a cooling sponge bath to the patient is to reduce the client's fever by promoting heat through conduction and vaporization. And since we are going to perform the cooling sponge bath to the patient, only the patient with temperature 40 degrees Celsius above can provide this cooling sponge bath. But less than 45 degrees Celsius temperature cannot or do not provide this cooling sponge bath to the patient. So after knowing the purpose of the procedure, we need to assess our patient. So first, we need to determine the client's body temperature. So I'm going to use the auxiliary thermometer. Okay. But first, we need to disinfect the thermometer. So from the bulb going down to the pen. Okay. Then I'm going to put this or place it to the auxiliary part of the patient. So, ma'am, I'm going to put this thermometer to your auxiliary part to determine your body's temperature. So, let's just wait a few minutes, ma'am. Okay. Okay, let's just assume that the body's temperature is 45 degrees Celsius. So, then now we can provide the client's cooling sponge bath. So, but first, we need to disinfect again our thermometer. So, but this time, from this part going upward to the pen or to the bulb. Okay. Then next, we need to gather all the equipment. So the things that we are going to use. So first, we have this cooling water for the cooling sponge bath. Then we have this the cooling sponge bath, and we have this damp towel. Then we have this bath thermometer to measure the temperature of the water. Then we have this clean glove. So after gathering all the equipment, we can now place this to the bedside of the patient. Okay, then next, we need to introduce ourselves to the client and also verify the client's identity. So, good day, ma'am. I am Jamala Kim as Alvis, your student nurse from Camarines Sur Polytechnic College. So, ma'am, can I please verify your identity? Can you please state your first name, middle name, and then your surname? Okay, ma'am. Then how about your birthday po? Okay. Then how about your age, ma'am? Okay. So, thank you, ma'am. Then next, explain the procedure to the client and why it is necessary and how the client can cooperate. So, I'll just explain the procedure to you, ma'am. So, for today, I am going to provide you a cooling sponge bath to lower your temperature and also to provide you comfort. So, you can cooperate with me, ma'am, by following the instructions during the procedure. So then next, we need to perform the hand hygiene to prevent the transmission of microorganisms from one patient to another. But before I came here, I already performed the hand hygiene and also observe other appropriate infection control procedures. Then next, we have to provide the client's privacy. So I already closed the curtain and closed the door room and to make her also comfortable and safe. Okay. So first, we need to measure the temperature of the water using the bath thermometer. So I'll just put the bath thermometer to the cool water. Then let's just wait a few minutes. Okay, the temperature of the water is 18 degrees Celsius. So we can use this cool water to our cooling sponge bath. Then next, I am going to wear the gloves. First, I'm gonna put this to our dominant hand. Then next, soak the towel to the water. Then next, wrap it to your dominant hand. Then pull the upper part like this. Hold the towel by your thumb fingers. Then hold. Okay, then next I am going to sponge the patient. So ma'am, I'm going to first sponge your face. Okay. Then next is the arm of the patient. Then next on the other side. Then next is the leg of the patient. And on the other side. So then next, sponge the back and buttocks of the patient. So but first we need to ask the patient if he or she would like to sponge her back and buttocks. So sir, would you like me to sponge your back and buttocks? So if the patient said no, then we cannot sponge the patient's back and buttocks. So it's just an optional, and because dumping the patient will always depend on the patient if he or she would like to sponge her back and buttocks. Then next, leave the area wet and cover the damp towel or a cloth. So okay. Then now I am going to place a ice bag or the cold pack, but I am going to use the full cloth and put it to the patient's forehead. So I am going to put this to your forehead. Okay. So I already sponged the one body part to another. Okay, the sponge bag take about 15 to 30 minutes. So to prevent the shivering of the patient and to rapidly decrease the temperature. Okay, so let's just pretend that it's already 15 minutes. So I am going to assist you again. So I am going to continue to assist you, ma'am. Okay. Just continue if the patient becomes pallid, cyanotic or shivers. Okay, then next we are again to reassess the patient for another 15 minutes, so that is all about the 15 to 30 minutes. Then next, I hopefully that the client's temperature is in a normal temperature. So okay, So as I inspect and check the patient, she is in a she is already in a normal temperature. So now we can remove the full flow to the patient. And then next, we need to document all the findings of the patient. Then lastly, we need to clear all the equipment by removing our equipment. So, um, then remove our gloves. And we need to put this in an appropriate. So that concludes my demonstration providing the cooling sponge bath to the patient.